despite what you're hearing in the media, there's a lot of fervor out there right now in terms of trying to create real meaningful healthcare reform in this country. We've had decades of problems with healthcare reform, and as to date, no one's been able to fix it. We have a unique moment in time right now to fix what's wrong with our healthcare system, and I think people all across the country sense that. They sense the urgency. They sense that something needs to be done now.
We've been working on this issue for the last 3 years, and we're so thrilled that healthcare reform may finally happen this year. We are strongly supportive of the public option, which we think would really help to make healthcare competitive and to keep costs down. We also are for universal coverage that provides affordable quality care for all. And we are against pre-existing conditions, rescissions, all the gimmicks that the healthcare companies have been using to protect their own profits at the expense of American healthcare. We've been the most active denomination at the state level that I've seen in terms of this, but there's another organization called PICO, which is an interfaith group that does include support from the Catholic Church as well as lots of other denominations, and we've also been participant with PICO. I've been excited by that. The other thing I've really noticed is that when a minister gives a sermon on healthcare, you get a tremendous response from the congregation. One of the things that we've seen in our Unitarian Universalist churches is that there have been a lot of very misleading letters sent to seniors about Medicare cuts that would be involved in the reform. And so they've gotten very wary and scared about that. And it's been very good to be able to reassure them that there's going to be no death panels, no euthanasia, and that the services to Medicare are not going to be cut, that they'll find savings in other ways.
Well, I think that basically the media is definitely trying to make people on the left or whoever's supporting the reform give up. The same tactic was taken with single payer very, very early in the fight, and I think people did just basically throw in the towel behind single payer very early in the fight because they were told that there was no hope. And I think they're trying to repeat that action with public option. I'm with the National Shout Out for Healthcare Public Option, and we're doing an action next Tuesday. We're asking everyone, sort of in the spirit of the Film Network, to wherever you are at that moment, at noon Pacific Daylight Time, this is national, but it's noon Pacific Time, to stand up wherever you are and shout out the words strong public option as many times as you feel comfortable within 60 seconds. And we're asking people to document that because there are millions of us, according to the polls, who support that, but despite all of the emails and phone calls, no one seems to be able to hear us. And I think this is a good way to get people to hear us. And you can find out more information. You can email us at shoutpublic@gmail.com, or we're also on changes.org under Universal Healthcare, and we also have a site on Facebook.
My name is Lori Vangerholm, live in Berkeley, and I'm 31 years old. About 10 years ago I got very sick. No one could figure out why. I was covered by Kaiser at the time, and after several years of getting progressively sicker, I finally sought out an endocrinologist who was finally able to diagnose me with Hashimoto's thyroiditis, which is progressive degenerative autoimmune disorder. And when I finally got a diagnosis, Kaiser not only denied that they had any wrongdoing by getting progressively sicker, but they also, when I reapplied for my Kaiser insurance, they denied me because I now have a pre-existing condition. So I was without insurance for 2 years. Finally, I got sick enough that I was entitled to disability, and I'm now on Medicare. And for everyone that's afraid of Medicare, I just want to say I've got a lot better care on Medicare than I ever did with my private insurance company. Even though Kaiser supposedly is a not-for-profit.
In terms of activism, this is the first time I ever attended a rally in my whole entire life. So in terms of working for healthcare and activism, this will be my first. But I have been in the healthcare profession since 1980. So that's where I will be pertinent in terms of, in a sense, helping out. My coworkers are definitely in favor of changing the system and definitely in favor of having universal health care. Yes, but at the same time, we are aware that this is going to take a slow process. It's not going to be a one-time deal. And so therefore, we need to keep moving. We need to start now, though. We need to start now to make the reform and keep working at it. It's not going to be just this one particular event. It's not going to be Obama's speech. It's going to be a work in progress, but we need to band together is the point.
What about the nursing students? What's the mood amongst the students?
The students are very optimistic in terms of their own career as helping people in the future, but at the same time they see the need for reform because they see how patients do not get the care that they need because of the problems with big insurance companies.
Are there any people in your community that are against this? I mean, in the school, in the faculty, do you have any? Are there faculty members that are actually against this in your school, for instance? Not name names, I just wonder, is anybody against this?
I can honestly say no. The reason for that is they'll have to be close to crazy to say that the reform is not needed. So I don't think that they'll take that stance.
What you're seeing out here today, a grassroots movement in support of healthcare reform, and that's happening everywhere around the country right now. So, I think this is the time that we're going to be able to achieve healthcare reform, whereas in years past we haven't been able to get it done.
Will not deny coverage for a pre-existing condition. WellPoint and Anthem Blue Cross will terminate any policy or incentive that rewards employees financially or otherwise for denying care and rejecting claims. WellPoint and Anthem Blue Cross will not use any resources, including member funds, employees, and